The study examined more than 1,200 cancer patients. Among those who experienced social and financial difficulties, housing insecurity was the primary driver of mortality. Study co-author Matthew Benegas is director of the Center for Health Equity Education and Research at UC San Diego.
What this shows is that compared to people who do not have housing instability, those who do had about a twofold greater risk of mortality or death when we account for these other social factors, as well as other patient demographic and clinical characteristics.
The other risk factors considered were financial hardship, food insecurity, and transportation problems. Bonega said the study did not answer the question of why housing instability was most likely to lead to death among cancer patients, but he said having inadequate housing is a multifaceted problem.
So, for example, is it the fact that, again, they don't have a stable shelter over their head? Or is it that they don't have consistent utilities in their house, right? So again, there's several things that could go into being housing unstable.
The influence of social risk factors on health are not always considered by medical prescriptions. Bonega says, for instance, it's not practical to prescribe the use of a medical device if there's no place at home to plug it in.
Social risk factors reflect circumstances that are influenced by where we live, where we work, right? Where we just interact on a daily life. We know that all of those conditions are going to impact us as individuals and the way that we encounter life on a day-to-day basis. And so I think it makes sense for us to say, hey, it's very likely that these risk factors, social risk factors, also influence our health.
He said the study was one way to point that out. Thomas Fudge, KPBS News.